Hi, I'm Dr. Jeff Rhode with Dental Compare. We're here at the 2008 CDA convention in Anaheim with Dr. Gene Casacrande. Dr. Gene, nice to meet you.
Jeff, nice to see you again.
You're with Milestone Scientific, and they got an interesting little machine here that helps us with local anesthesia.
Right. It's the newest innovation in the computer-controlled delivery system field. Mm-hmm. It's called the STA unit, and it's produced by Milestone Scientific. It's innovative in a number of features that we'll talk about. Mm-hmm. Mainly, this is used for single-tooth anesthesia and, in fact, all the injections that dentists do. So this takes the place of the syringe that we've been using for about 150 years.
Right, and that's really kind of the sticking point for a lot of people. I mean, the patients, this is a fear factor. The injection is always a tough part of the appointment. It's
exactly.
Like you get past that, and then the rest of the appointment goes okay.
But unfortunately, a lot of our colleagues don't recognize the fact that patients are afraid of the needle and the dental syringe. And so this is an alternative to that, and it has many features that are less threatening to the patient. And of course, as we go through, I can explain to you how much easier it is for the dentist to give injections with this delivery system, as opposed to the syringe that we've been using for, like I say, 150 years.
Right. Well, let's look at the system. I mean, even the needle's a little bit different.
Yeah, basically it's a very simple system. It just has a power cord, and it has a foot control that controls the flow rates. But the main flow rate is this flow rate, which is a drop every other second.
Mm-hmm. Cruise.
It has actually cruise control, so I can take my foot off the foot control. And it will produce this flow rate, which is below the patient's pain threshold. So this needle could be anywhere in the body, and the patient would not feel the delivery of the anesthetic. This could be in your foot, it could be in your palate, and you would not feel the delivery of the anesthetic.
Now, that's a particularly sensitive injection, too.
It's one of the worst injections we give as dentists, of course. But I can give an injection in the palate the patient barely feels. And it's very comfortable, very easy, and that's what this technology is about. This flow rate, together with the ability to control the needle with this ergonomically designed one handpiece, allows us to do some injections that are unique and fairly new, although they're now in textbooks and being taught around the world. Basically, this injection, or this handpiece, allows us to control the needle. It's ergonomically designed. It's a lot less threatening. We have great control of the needle.
And it doesn't look anything like a syringe.
It doesn't look like a syringe. As a matter of fact, I'll show you how we can break it even smaller and hide it so that the patient never ever sees the needle. Mm-hmm. So that's one of the other features. But the ability to control the needle along with that flow rate allows us to do injections that are going to be able to anesthetize multiple teeth with just one injection and all the related tissue without numbing the patient's lip and face.
Right.
And that's very big for our patients. They hate that feeling of numbness, the collateral numbness that we give that they have to suffer through for an hour or two after the appointment.
Right. Well, the name of the system, the STA, is really designed for single tooth anesthesia. How do you get just one tooth in there?
Okay, many times because of this system, we can eliminate doing blocks and infiltrations, okay? Blocks that numb the tongue and half the patient's lip and face. This allows us to give an interligamentary injection that's very easy to give, very comfortable for the patient, doesn't cause any tissue damage. And we can do that by using something called dynamic pressure sensing. This will, in real time, tell us the exit pressure of the anesthetic as it's leaving the needle, as it's going through various tissue. So as like an apex locator, it will lead us to the periodontal ligament space and tell us when we've arrived there. It'll also tell us if we've pulled out of that space, or it'll also tell us if we blocked the needle. So it allows us to do a single tooth anesthesia that will give us much longer duration than the typical periodontal ligament injection that we're used to giving with a syringe. In that injection, we're injecting a small volume of anesthetic under tremendous pressure. With this injection, we're injecting much larger volume. In fact, of lidocaine around the molar, I can put a full cartridge of anesthetic around the molar without the patient feeling anything, anesthetizing the tooth for 30 to 40 minutes, which is unique.
And then the fact that you don't get tissue damage is really the control of the computer letting that anesthetic out.
Exactly, it controls the pressure. As you know, with the syringe, we can exert enough pressure to even crack cartridges, which we've done, I'm sure.
Right.
With this, you can't exert overpressure.
Right.
Because it'll just stop. It'll tell you overpressure and stop. Right. So it's a fail-safe.
So what are some of those other injections you can do? I know there's, let's talk about one of the palatal ones.
Okay, the injection I think is most valuable is the AMSA injection. It's an injection given in the palate between the premolars, between the free margin of the gingiva, middle of the palate. We give this injection in this area, and it's going to numb all the way from the mesial buccal root of the first molar all the way through the central incisor. In fact, 5 teeth. And all the related tissue, all the palatal tissue and buccal tissue from the premolar through the central incisor.
Through one thing.
For one injection, and it doesn't numb the patient's lip and face. So this is one of the most important benefits of this system. What's more, you can consider if you had to anesthetize a quadrant for quadrant scaling root planing, you could give this injection here and an injection behind the second molar, and regular infiltration. Now you've numbed the whole quadrant with just 2 injections, and the patient's lip and face is completely normal.
That's
you can
correct.
do quadrant scaling, you can do a restorative dentistry, anything else you want to do. So this is a unique injection.
That's great. Any other features of the system itself that you want to talk about?
Yeah. Basically, this is an advancement in the previous versions in that it has an automatic purge that purges the air out of the system when you load the cartridge into the cartridge holder. It allows us to adjust the volume. It allows us to have various flow rates. In other words, it doesn't just have that single flow rate. It also has another flow rate when you're giving a block injection.
Load, normal, load.
It has 3 different flow rates. It has a control flow rate, it has a rapid flow rate, and then it has even a turbo flow rate, which is even faster than that.
Faster.
Yeah, all controlled by the foot pedal. What's more, it has cruise control. So you can, after 3 seconds, take your foot off the foot pedal and allow that control flow
Until
rate
you're
throughout
done delivering the
until you're
anesthetic.
done delivering the anesthetic.
That's exciting.
Yes, it's a unique and very innovative feature that the patients love. One of the things about this is that when a dentist uses this, the patient appreciates the fact that the dentist has gone out of his way to make the most important part of the dental experience to the patient as comfortable as possible. And I think that's really the key. This allows you to give injections that are easy, safe, use less anesthetic, don't provide collateral anesthesia to the lip and face, and it's less stressful for the dentist to give these injections.
Right.
So it's a win-win-win for everybody.
Yeah. Well, Dr. Gene, thank you so much.
So nice to see you.
Now, if you'd like more information about how to help your patients get more comfortable with the anesthesia part of things, just click on that request information button. I'm Dr. Jeff Rhode with Dental Compare.